Okay, so good evening everyone. You're welcome to our 30 minutes conversation on question and answers on mental health issues with Dr. Edebi. Let me start out by first introducing myself. So I'm Dr. Edebi. I'm a consultant psychiatrist and a psychologist. I am the medical director of Grace Hill Place Hospital, managed by partners and consultants of the Grace Hill Behavioral Health Services Limited. We provide mental health services and addiction treatment. So we're starting this series once again all through the month of August and all through the month of September. All Mondays in the month of August, all Mondays in the month of September. Actually, it's our 3rd year anniversary. So it's our 3rd year anniversary. Grace Hill turns 3 this month, and so we'll be having conversations all Mondays just addressing mental health issues. I'm excited because for me, every opportunity to always talk about mental health, to answer commonly asked questions, to answer the questions in the mind of many people out there is always for me something I'm excited to do. And the goal of our conversation literally is to demystify mental illness. That is why we're having this talk, to demystify mental illness. That's number one. And number two, also, it's to equip people with appropriate tool for mental well-being. That is the goal of our conversation. So today I'm going to be taking our first question in the next 30 minutes, and the clock has already started counting. So I'm going to just talk about I'm going to go right into the questions for this evening. Just in case you are listening and you're watching, you could always join in terms of, you could always ask your questions on the comment section. You could ask it right here, right now, or you could also send your questions ahead so I could take them to evelyn.onovo.gbhs.com. I'm just going to put it on so we can see the email. Evelyn, I'm trying to, yes, evelyn.onovo.com.ng. You could send it there. You could send your questions ahead just before we come up. You could always send your questions there, and I will definitely see them and get back to you. You could send your questions there. I'm just putting those things up. I have to put on several platforms. We're streaming this live both on Facebook and on Instagram. I'll go into the question, but I just want to get this out of the way. So evelyn.onovo at GBHS, Grace Hill Behavioral Health Services .com.ng. Yes, that's it right there. Fantastic. So send your questions in, anything on mental health, and I will be glad to answer it this coming Mondays. So today we're going to answer a very important question. How do I help a loved one who requires mental health assistance? That's, you have a loved one, the person you suspect or you know that the person has a mental illness, and you want to get that person to seek help. That's a question I often get asked. When I have conversations, people often ask, how do I get my loved one to seek treatment? So I'm going to just break it down into 3 categories this evening. First thing I'm going to talk about is why in the first place don't people seek help. So if you understand why people don't seek help, it may help you to know how you can approach them when you have to assist them to seek help. I'm going to just talk about 3 things. The first reason why people don't often seek help, in no particular order, is 1, they genuinely don't know they need help. What we call they lack insight. So the person may be ill and doesn't even know that they are ill. They in their own mind and by their own perception, they are fine. Whatever they are doing may be abnormal to others, may be distressing to others, may be a deviation from the normal from others, but as far as they are concerned, they are genuinely sincere when they say, I do not need help. They do not know that they need help. They lack insight. Another reason why people often don't seek help is that they don't want to look weak. Some people see seeking for help as agreeing that you have to be dependent, maybe dependent on medication or dependent on someone, and looking weak is not something some people like, so many times they just refuse help. It's not like the person doesn't know they need help, but admitting to needing help is like admitting to being weak or needing somebody to lean on, and for some people it's a really major deal. So that is another reason why people don't seek help. And the third and the final reason why people don't seek help is the fear of stigma. So it's no longer an issue of they're afraid of looking weak, but to accept you have a mental illness. Now this can be also from family members, to accept there's mental illness. Now the stigma of mental illness is so real and so profound, so loud, if I may use that word. So the fear of stigma often keep people away from receiving help. Unfortunately, when it comes to mental illness, it is said that only 1 out of, some say 3, some say 4 of people who will actually need help at the end of the day access help, and it's for these various reasons. 1, they don't know they need help. 2, they know they need help but don't want to appear weak. 3, it's not a matter of being weak, it's just that the stigma is real, so they avoid seeking help. Now, having established that, what are the warning signs? How do you know when you should intervene? So today the question I'm answering today is, how do I help my loved one who needs help and doesn't know they need help? How do I get them, or they may even know, how do I get them to receive help? That's a question I hear often. So how do you know when to intervene? I'm going to list out 4 things. Number 1 is that behavior. It's called, these things I want to list out are called the warning signs of abnormality. Number 1, you want to ask yourself, is this behavior now when it comes to mental illness, let me just quickly define this. Mental illness is defined, or mental challenges, legal definition now, it means any disease or condition affecting the brain that influences the way a person thinks, feels and behaves, or relates to others and to his or her surrounding. In our own simple words, I like to define it a bit simpler and say anything that impacts on your behavior, your thinking and your mood. Basically what they said too in legal BTM. So if that behavior, thinking or mood becomes a deviation either from societal normal or a deviation from the individual's normal. So let's say that in time past, the individual used to be someone that comes in early, used to be active, used to be someone that was caring, someone you could rely on, and now there's now a deviation. It's like there's a deterioration in the person's quality of life, the way the person used to function. There's a deviation, or there's even a deviation, maybe sometimes it's a deviation from societal normal. So societal normal can be like, okay, societal normal is we don't sleep with animals, so we don't sleep with dead bodies. That's a deviation. So there are some people who have behaviors, necrophilias, they sleep with dead bodies, they sleep with animals, zoophilias, so if there is a deviation, you may need to intervene, you may need to seek help. Another D you look for is this behavior, thinking or mood, has it become dangerous? You want to look at that. Is this behavior, thinking or mood, has it become dangerous such that it can cause harm either to the person or to someone else? The third D is, has it become, has this behavior, thinking, or mood, is it affecting functioning? So what you say is it causing dysfunctioning? Is this person now dysfunctional? So for example, the person is unable to carry out their activities. Maybe you have a mother can no longer take care of her children because her behavior and her thinking and her mood. Maybe the person believes that they are aliens, or they are people after them or after her family, and then she's withdrawing her children from school and saying, let's do homeschooling, let's all stay inside the house, nobody's going out, or the husband says nobody's going out and all that. Is it affecting the person's functioning? Dysfunctional. And then the final D is this behavior, thinking, or mood causing some form of distress? You could ask your questions as we go on. You could ask your questions. So is it causing some form of distress? So those are the 4 things. Those are they're called the warning signs of abnormality. When you see either there's a deviation from the person's normal or societal normal, this behavior is dangerous, or this thinking is dangerous, or this mood is dangerous, or is dysfunctional. The person, it may even be someone mourning somebody and can no longer function. Over 2 years, you are still mourning, grieving, and you can't function. The person may need some form of help. And then finally, is it causing distress, either to the person or to the people around? So some personalities cause a lot of distress to the people around. May not be distressing to the person, but it may also cause a distress to the person. The person may be having some form of panic attacks, and it's causing a lot of distress. So having established that, now to the core of our conversation today. How do I help? How do I help my loved one that needs help, that may not even know they need help? Either they are in complete denial, or they are not even aware that they need help. Number 1, I'm going to mention 3 things. Number 1 is you want to discuss with that person. So what do I mean discuss? So the first thing you really want to do is have a conversation. Tell that person. So I'm talking about now not only people with mental illness, so people also with an addiction problem. So someone may have an addiction problem. It's also on that. Addiction is also covered under mental health. Because of course an addiction problem can cause some level of behavior problems, can cause some level of thinking problems, and of course can impact on the person's mood. In fact, by definition, a drug of abuse is called a mood altering drug. So I'm talking about both people who have addiction issues and they don't want to seek help. How do you help the person? Or someone who has a mental illness and doesn't want to seek help, how do you help the person? First thing, you want to discuss with the person. So discuss with the person, pick a time and a place, approach with empathy. In this conversation, you don't want to come across like forceful. The first conversation, the first initial engagement you want to have with somebody, trying to get them to seek help, you want to be empathetic. Being empathetic also means that you are not going to use very strong terms like, you are mad, this your behavior is abnormal, this your behavior, you are not going to use those kind of words. You want to come from a place of empathy. You want to talk to them gently. You want to give them a listening ear. Having picked the time, maybe it's someone who's abusing drugs. You want to say, okay, let's just take a name. Maybe you say, Popo, I want to talk with you. I'm coming over. I want to talk with you. I want to have a conversation with you. Because many times, especially when it comes to drugs, the people who are struggling with it actually already know they have a problem. But they tend to put this position of being in denial because they really want. But if you come in an empathic way, they may give you a listening ear. Another thing you can do is when you speak, don't say you make it about like me. So it's called asking them for like a gift. So for example, you can say do it for me, go into treatment for me, or do it for your daughter, do it for your children, do it for this person, do it for that. Give yourself, or you can say give yourself that beautiful gift. Like for example, let me give you a perfect example. There was a time I was speaking with someone and this man was refusing had an addiction problem, was refusing vehemently, and he kept saying, it's my life, it's nobody's business what I do with my life, they should leave me alone, they should stop bothering me, after all, it's not their money I'm using, it's my money I'm using, it's my life, and all of that. So I said to him, I said, you know, the way you are going, sir, you may not be, you know, it's a beautiful thing to be the one to lead your daughter down the aisle when she's getting married. You know, so give her that gift of being that father that will be there to take your daughter's hand. Let nobody else replace you on that day. I know it's your life. I told you, I know it's your life. I'm not here to make it sound like it's not your life or it's not your money. But give this gift to your child. And at that moment, the man broke down and started crying. So you can tell them, give me that beautiful gift. Sometimes that leverage may get the person to tilt. You know, when I say do it for us. Another thing that you can do while discussing. So the first point I'm talking about is discuss with the person. Is you may need to facilitate that appointment. So even after you've talked about it, okay, let's go for treatment. The person may be willing, but if you leave it at that and say, I'm going to trust you to make that decision, it may end there. So you may need to take another step and be the one to facilitate the treatment. Call the professional, seek out the professional, go on the internet, find the professional, you know, connect with the person, connect and say, oh, I found someone, I think you may like this person. You know, sometimes some people are, what's the word now? They are going back and forth whether they want to do this or not. So go do that, go that extra mile for them, get it, get the person, get the connection, connect with the therapist, connect with the psychiatrist or whoever, and facilitate that. Then another thing you may need to do for this person is that you may need to make payment for them. So just so that you make it seem like, look, don't bother about the payment. I've already paid. I've already connected you, you know, and I've already paid. Sometimes that is helpful. That is helpful. So that is all about discussing. That's the first thing you can do. Now let me say this. Having discussed, discussion does not always work. So you move on to step number 2. Now step number 2 is not so pleasant. And step number 2 and number 3, they are kind of similar. So the first thing is discuss. The second thing is what I will call to, you know, see me hesitating, but this is important, is that sometimes you may need to deceive the person to receive treatment. So start out first by talking with the person, discussing with the person. So the first D is discuss. The second D is deceive the person. Now what do I mean? You may say, wow, that's wrong. That breaks the trust. Yes. Notice I slowed down. Notice I was a bit hesitant because it may not sound like the most beautiful thing to do. But however, it becomes necessary, especially when you are dealing with the reason for not denying treatment. Sometimes the person may not have the mental capacity to be able to make proper judgment. The person may not know that they really need to have that treatment. So you may need to, there have been cases where you tell the person, oh, we are going to XYZ place to see XYZ person, and then the person gets there and discovers that, oh, I'm the one that's here for treatment. I know it doesn't sound really nice, but like they say, drastic times calls for drastic measures. Sometimes you need to deceive the person to receive treatment. But this I can guarantee you, treatment for mental illness is very, very, it's very, very, what's the word I'm looking for now? A lot of people receive treatment, a lot. I mean, it's a myth to think that, oh, can people really receive mental health treatment and be cured or attended to or get better? Yes, it's actually a lie to think that you cannot receive proper treatment. So why I said that is that even though they may be deceived into treatment, they will thank you for it later. In fact, let me share this story on deceitfulness, good deceitfulness, as far as getting the person to receive treatment is concerned. So a young lady walked into the office with her friends, and she had an attempt on her life, and she was depressed, and she walked into the office with her friends who told her they were just going somewhere. So when she got into the office, Of course, she walked into my office. She was quite upset, very upset. And I asked her, I know you are upset. She said, yes, I'm upset because they didn't tell me we were coming to see a psychiatrist. They just made it look like we're going somewhere. They deceived me. So I said, I know you're upset. So we had a conversation. And at the end of the conversation, after about an hour, I said, how do you feel now? She now said, you know what? I'm actually glad I came. So I'm just saying that you may deceive them. They may be upset in the beginning, but sometimes they will go back many times, not sometimes, many times they will thank you for it. And then the third and the final thing is demand it. So first, discuss. Second, deceive. And third, if deception doesn't work, because sometimes deception doesn't work, the person says, no, I'm not going anywhere. Say, let's go visit it. No, I'm not going. Dad, no, I'm not going. So you may try all of those techniques. They may not work. When all those, the first two fails, you have discussed with the person is not listening. You have tried to deceive the person to get treatment. The person is not listening. The third and the final thing you should do is demand it. So what does it mean? It's like saying tough love. Tough love is when, now this is not easy. Trust me, number 2 and number 3 is not easy. Especially number 3. It's not easy when you have to demand and maybe call the crisis team or go and get a court order. Now let me say something here. Many people often wonder. So let me say a bit about what the law says, especially in Lagos State. Now the good thing, the beautiful thing about Lagos State is that the law has been passed. The mental health bill has been passed here in Lagos. We're still trying to work on it at national level, but at least in Lagos it's been passed. Lagos State, Nigeria is where I practice. You know, the law actually talks about the involuntary patient, which means a person who is taken to a mental health facility for treatment without consent under a court order or a certificate of urgency. So the law allows you to admit somebody involuntarily. Now, mental health is one field of health care where someone can be allowed to be admitted against their consent. So there's now, and interestingly, you can even walk into a mental health facility voluntarily. The law still allows that if at some point in the treatment it is judged that you need this treatment and you now want to involuntarily discharge yourself, even though you walked in voluntarily, the law actually allows you to still be kept involuntarily if you are not thought to be fit. I'm not saying this to scare anybody. I'm not saying to say, oh wow, if that's the case, then I'm not going to volunteer. No, that's not what I'm saying. But I really want us to understand that there's a portion of the law that allows you for involuntary admission. So there you have it, folks. Let me just read out something. Say, where a patient lacks mental capacity or otherwise fails to appoint a legal representative in writing, now I'm reading from the bill, the Lagos State bill. Writing, the legal representative shall be appointed to be in the following order. In other words, when someone fails to say, okay, I'm giving the right, someone who has a mental incapacity challenge, fails to write down that this person should be the one to make decisions for me. Whether the person writes or not still does not stop doesn't stop one from being under care. And now in this fellow order, the first person that the law acknowledges that has that capacity to do that on behalf of the person, whether the person writes is written or not, is number 1, your spouse, except you are permanently separated. Number 2 is your son or your daughter, your children over the age of 18. So your kids over 18, if they consider that their parent has a mental health issue and needs to be taken into involuntary treatment, the children can do that. Number 3 person that will be considered after your spouse is first, the second person is your children, the third person is your parents. So a parent who can make that decision, either parent actually, they say by mutual consent, and then third is the fourth and final person is the court can appoint anybody, could be your sibling, could be anybody, so there you have it. Those are the 3 things that you can do to help someone seek treatment. First, have a conversation, discuss. Second, try to get them there even when they do not know what exactly you are doing, which is true. I struggle with this, but it's necessary. Deceive. And number 3, if discussion and trying to deceive them to get treatment is not working. The first should always be discussion. Always try to engage, be empathetic, and all that. Follow all the principles that I talked about if you were listening earlier. The third and final thing, when discussion doesn't work, deception doesn't work, is you demand it. Thank you. So there you have it, everyone. Thank you so much for tuning in, both on Facebook, on our Facebook page, and thank you, Aliladia. I see you. I see quite a number of people. I wish I could just give a shout out. Yes, thank you so much, Big Pastor 232, for putting those words: discussion, deception, and demand. Thank you so much. Yes, so 3 things you should do. And remember, I talked about the things you should do while discussing. Be empathetic. You may need to facilitate it. You may need to pay for the appointment. You may use the gift approach, where you say, do it for us. Give us this gift to go into treatment. Do it for yourself. Give yourself this gift, and all of that. Someone is turning 40 and they have a drug problem. Say, give yourself the gift of sobriety as you turn 40. Give yourself the gift, something like that. You can use those words. Those are words, and be empathetic. Thank you so much. Do have a lovely evening. See you next week, Monday. Like I said, every Monday on by 6 p.m. Facebook Live. Facebook Live. Okay, Dr. Anyara Nameka. That's from here. Thank you so much for joining me. Thank you so much. Yeah. So see you every Monday, by 6 p.m. West African time, Facebook Live, and that's on our Facebook page, Grace Hill Behavioral Health Services, and on my personal Instagram, that's IamPDoc. Please spread the word and send in your questions. I will be answering. Next week, I will be talking about panic disorders. That's what I will be talking about next week. And I don't know what I will talk about the week after, but send in your questions. Thank you so much. Have a lovely evening. Bye-bye.